Hi, Sophia. Great to see you today. You're here for your LEEP, right?
Yes, I'm a little bit nervous. What is a LEEP exactly?
LEEP stands for Loop Electrosurgical Excision Procedure. I'll use this tiny loop-shaped wire to remove a piece of your cervix. I'll only take a small piece, where I found the high-grade cervical lesions during your colposcopy. This loop uses electricity instead of having to use a sharp knife like a scalpel. The whole procedure only takes a few minutes and is done right here in the office.
Will it hurt?
No. I will put numbing medicine into your cervix using a small needle, just like the kind they use at the dentist. You might feel the needle, but you shouldn't feel any of the rest of the procedure. You also might have some cramping for the rest of the day.
Okay, that's not too bad. So, how does the procedure work?
You'll undress from the waist down, sit here, and rest your legs in the stirrups, just like you usually do for your annual exam. I'll put this pad on your leg to protect you from the electricity. Then I'll use a coated speculum to see your cervix. Once I'm sure you're numb, I'll use the wire loop to remove a small bit of your cervix. It's very important that you lie still for that part. Then I'll use this instrument to seal off the cut I made and help your cervix heal. After the procedure, I'll send the tissue to the lab to test and make sure that we got all of the abnormal cells and that we don't need to do any other procedures.
So, you're taking a piece of my cervix? Does that mean I won't be able to have children?
No, this procedure doesn't affect your ability to get pregnant. The cervix is pretty long, and I'm only removing a small piece of it. This procedure also doesn't increase your chance of having a miscarriage later. In fact, it's better to treat a high-grade lesion before you get pregnant, so that you don't risk developing cervical cancer while pregnant. But it's a good idea to let your OB know that you've had a LEEP.
Okay, thank you for explaining all of that, Dr. Davis.
Of course. Once I'm done, I'll put some Monsel's paste on your cervix to help it heal. Some of it may come out over time, so don't be alarmed if you get yellow or blackish discharge. I suggest you wear a pad or panty liner just in case. Some cramping and spotting is normal and should be expected up to a month. But if you have heavy bleeding or discharge that soaks through a pad in an hour, fever, or increasing pain, please call me.
All right, I'll be sure to do that.
Good. Once the results come in from the lab, I'll call to go over them with you. And don't forget, it's still important to follow up and get regular pap smears and HPV testing.
Got it. Thanks, Dr. Davis.
Anytime, Sophia. Now let's get started.
A LEEP takes a small piece of your cervix away to keep cervical cancer at bay.